I'm joined by Mr. Links from Namibia Fact Check. We are going to discuss on the falsehood of COVID-19 vaccines. Okay, Mr. Links, according to your article, whereby it shows that people are claiming that COVID-19 vaccine is killing people, and according to your research, what are your findings?
Well, I mean, it's clear that the vaccines aren't killing people. I mean, if you just look at here in Namibia at the moment, and you look at the death numbers that are announced daily, I mean, it's clear that the people dying are unvaccinated people. There are, I think, I mean, there are reports that there have been now, I think, about 6 people who've died, out of the almost 100 and over 100,000 that have been vaccinated. But these people were usually elderly people, older people, elderly people with comorbidities. And I mean, so their systems were already weak, and the vaccines couldn't help them.
Because the body, they are already, the immune system is already weak, and the vaccine can't help.
Yeah. So they didn't die of the vaccine; they died of the disease, of COVID-19 disease.
All right.
So I mean, we haven't had a single case of somebody actually dying here in Namibia because of a disease, because of a vaccine, of the 2 vaccines we have. And that's something, if you look at the rest of the world, I mean, that's something that comes out from the data as well. It's not the vaccines killing people. It's not the vaccines making people even sick, as some would claim that it's because of the vaccines that now there's a third wave here in Namibia, for instance. It's not because of the vaccines. It's because people aren't adhering to the health regulations. People aren't getting vaccinated. People are still going to gatherings, to churches, and to other places without wearing masks. That's what's happening. That's what's driving this third wave. That's what's leading to people getting sick, and that's what's leading to people dying at this stage.
Okay, so far some people are still claiming that the vaccine is useless because some of the people are vaccinated, but they're still dying. What can you emphasize on that?
Well, I mean, no vaccine is perfect, but all the vaccines show great efficacy in terms of preventing hospitalizations and preventing death. And preventing a severe disease, so preventing a severe infection. And the same is true of the 2 vaccines that we have here in Namibia. I mean, the claims, once again, aren't true. The vaccines aren't useless. And if you look at how, infections, hospitalizations, deaths have come down in other parts of the world where there are increasingly high rates of vaccination, it makes the case for how effective the vaccines really are. I mean, of course, now there's a new variant of concern which seems to be quite strong and seems to be actually a challenge for some vaccines. But I mean, that remains to be seen at this point in time. But on the whole, the vaccines aren't useless. And if we want to get out of this situation, if we want to go back to some sort of normal at some point, this at the moment is basically our only route. The vaccine is our only route, because there are no effective treatments out there. There are no cures out there at this point in time. And all we have at the moment is the vaccines to get us to the other side.
Okay, Mr. Links, and what can you say on India's death rate? Since now India has recorded 250 million people died because of the coronavirus, and hints that India recorded that a number of people dying. And what can you say? due to the vaccinated people in India. Are they also
Yeah.
dying, or maybe they are
No,
not
no, no. I
dying in
mean,
that cases?
no, no. Let me just correct you there. I mean, they are not 250 million dead in India.
Mm-hmm.
It's more like 250,000.
Okay, okay, correct.
Yeah. So it's still very bad. I mean, that's 250,000 people. That's almost the size of Windhoek's population.
Okay.
In the whole of India. But for a country with over 1 billion people, I mean that is not a
It's not
I don't
a
want to
big number.
I don't want to minimize the deaths. I don't want to
Okay.
do that. But it's not in that sense. It's not a large number. But I mean, they've had, I think, I mean, in the article I report that they had about 500 people, almost about 500 people who've died after they'd been vaccinated. And by that stage, I mean, I think almost 300 million Indians are now vaccinated. So 500, 500 out of 300 million really is 0.0.0. A really, really small number.
Okay.
And as I report, I mean, from what I've been able to gather and from what has been reported, only one person, an elderly man in March this year, an elderly Indian man, has actually died because of vaccine-related complications. Out of all those hundreds of millions of people, only one that they could actually trace at this point in time to, he took a vaccine, he was given a vaccine, complications developed, and then he died. So, I mean, that once again, we're talking about such a small percentage, such a minuscule number that, it makes a lie of the claims that, around the world, thousands and millions of people are dying after getting vaccinated. That simply isn't the case. I mean,
Okay.
there's no evidence of that. So,
Okay.
yeah.
On the falsehood, why are this group of people trying to push misinformation that the vaccine which is from China is deadly? This creates fear in Namibians, and they are among the nations that have these vaccination options.
Yeah. No, I mean, there's racism at play in some of these accusations. There is xenophobia at play in some of these accusations. There is sort of a negative sentiment towards China in some places. Even here in Namibia, I mean, a lot of people have a negative view of China and of Chinese people, which is concerning.
Mm-hmm.
So I mean, so the anti-vaccine propagandists, they feed into this sort of thing, this existing sort of resentment towards China and the Chinese. They feed into this, and then they stoke it. They put fuel on the fires. They blame China for the pandemic because that's where the COVID-19 pandemic started. They want to cast doubt on the Chinese vaccines, as if they are poor quality, as if they are, they might be poisonous and the like. So there's a lot going on, not just here. I mean, this is something that's around the world. You've seen the reports about not just Chinese people, but Asian people in general being attacked on the streets in other parts of the world, being beaten, and so forth. There are many videos on social media about this, and it's because these people who create these sorts of lies and falsehoods, they feed into a sort of anger that people already have towards Asian people, towards Chinese people over the COVID-19 pandemic, and they stoke this, and the point is also to discourage people from taking vaccines. The aim of the anti-vaccine movement globally is to discourage people from taking vaccines. They don't want people to take that, so they'll use any avenue, any story, any lie to to make their point, to try and get people not to take the vaccines. And we have to be aware of that. This is busy happening. It's not just happening in Namibia. It's not just happening in South Africa. It's happening across the continent. It's happening around the world. This anti-vaccine movement has been globalized. It was largely a US-based movement, but with COVID-19, it has gone global, and people have to be aware of this.
Okay, which website should we trust regarding COVID-19 information, locally and internationally?
Yeah, so I mean, I would, I mean, if for many people, the cost of data is a concern, the cost of surfing the internet is a concern. So I would say to people, my go-to, and the one that I would recommend to anybody, is the World Health Organization's COVID-19 web pages. There you can find, I mean, answers to all your questions, about most things, everything about COVID-19, what's happening, about vaccines, about treatments, about investigations, about daily updates, everything, it's there. So if you don't have a lot of data, that's where I would advise you to go, because I mean that's my first point of call as well when I'm looking for information, and so I would advise people to go there. If you have more data, I would advise you to also take a look at pages like My World in Data. It gives you nice maps and keeps an up-to-date global situation of what's happening in terms of vaccines, what's happening in terms of COVID-19, and so on. Nice maps. I would advise people to go to the Johns Hopkins University website, COVID-19 websites, web pages. I would advise people to go to the US Centers for Disease Control and Prevention web pages. All of these are valuable sources. And if you can use the one to check if the other one says the same thing. And if they all sort of on the saying the same thing, then you can sort of reach the conclusion that yes, what I read was true, because all of these experts, all of these credible authorities are saying the same thing. If you don't just want to go to one source, then I would advise you to go to all these others as well and check which one is best for you, and check up on the others. I mean, that's what I do. I see if I encounter information on one, then I will go and check on the other, on the others with the others. Maybe they also have that information, and if they have it, then it must be that must be true then. So that would be my advice to people.
Okay, before we come to the end, what is the best way to determine whether information being forwarded on Facebook and WhatsApp is fake or real?
So the first thing I would tell people, if you see a post in your WhatsApp or a voice note or something, a video or something, the first thing if it's an official thing, it would have it would be on an official letterhead. It would have an official emblem on it. If you look at the Ministry of Health things that they send out, you can clearly see immediately before you've even opened the document on WhatsApp that it's a Ministry of Health, because the Namibian emblem is right there at the top of the page, and across the page it says Ministry of Health and Social Services. That's what credible information looks like. It's on the letterhead. It's got a clear date on it. It tells you who it's coming from, and at the end there's a stamp or a signature, or a stamp and a signature. That is what credible information looks like. So if you're seeing some post in your WhatsApp group or somebody sharing it, and all you can see is forwarded many times, but you can't see who sent the thing, who wrote the thing, who's talking, then I would say that's not a credible bit of information that you're looking at. And I would caution people. I mean, why would you take your medical advice in a WhatsApp group? Why are people looking for medical advice in WhatsApp groups? I mean, do you also look for financial advice in WhatsApp groups? Are you asking people for financial advice in your WhatsApp groups which there are people you don't know? So why are you taking medical advice from people in WhatsApp groups? Really, I mean, that shouldn't be happening. Rather, if you need medical advice, go to a medical center, go to a healthcare provider, go to a hospital or clinic or so on. If you need advice, if you need information, don't just take the first person who posts something in a WhatsApp group as some credible authority. I don't get my medical advice in WhatsApp groups. I don't follow people's advice in WhatsApp groups. So I mean, I don't understand why other people do that. So I mean, that would be me. That would be my caution to people out there.
Okay. Okay, that brings us to the end of our conversation with me, Arvin, with the Namibian Fact Check editor, Mr. Links. Okay, thank you, Mr. Links, for joining me.
Thank you, Erwin. It's always a pleasure.
All right, good day.
Good day to you too.
All right.